I'm Dr. Nithya. I'm a child psychiatrist in Rainbow Children's Hospital at Banjara Hills and Kondapur branches. And I'm here today to talk about hyperactivity in children, or ADHD we commonly refer as. So when we try to understand hyperactivity, often I have parents coming and telling me that their child is hyper or aggressive or temper tantrums. Also they refer to as hyperactivity. But in truth, when we are talking about hyperactivity, that means that the child is not able to sit in one place, is continuously moving around, and is restless. So this can be a part of ADHD, or attention deficit hyperactivity disorder. But we have to keep in mind that hyperactivity could be a part of normal development in the early childhood years. Up to 6 years, the child can have a lot of energy and may appear hyperactive. So not every time we diagnose as ADHD. So ADHD, if we try to understand, it is a developmental condition, or it is neurodevelopmental we call it. That means that as a part of their brain development itself, it is there and it is not a disease. So this is seen in about 5 to 7% of school going children worldwide. And if we try to look at what is the cause for ADHD, we still do not know the exact cause. But there are some structural changes in the brain, especially in the frontal region of the brain, that have been suggested. But if you do an MRI, you won't find any changes. So it is at the neuronal connections level or in the level of neurochemicals. And there is also a genetic aspect to it. It can run in families, but may not necessarily be all the time. But what ADHD is not caused by is bad parenting or wrong parenting practices. It is not because of that. Screen time can worsen ADHD, but it is not a cause for ADHD. So now if we try to understand what exactly is this attention deficit hyperactivity disorder, there are 3 types in it. So one is the ADHD predominantly inattentive type, hyperactive type, and the combined type. So children can present in any of these ways. And it should be starting at an early age, less than 12 years onwards, and in the early childhood period, we should be seeing these features. So when we talk about hyperactivity, the child is unable to sit in one place, has a lot of energy, is continuously running, jumping. Teachers often complain that the child is not sitting in class and disturbing other children. Like as if in Telugu we say Kaliki chakralu unnattu is something we use, that the child is moving around a lot. When we talk about impulsivity, that means that the child is unable to control themselves. That is, they may blurt out answers even before the question is completed, or they may interrupt conversations. They cannot wait for their turn. And when it comes to inattention, the child is not able to sit and continuously focus. The child is distracted easily by small sounds or keeps getting up with some excuses. And the child loses interest easily. From one task to another, they keep shifting. Or the child does not remember where they left their things. They may lose objects or like pencils, pens in the class, etc. They appear not to pay attention, or they may daydream a lot. These are some of the features, but the criteria is that it should cause impairment in the everyday functioning of the child. In milder conditions, the child may not show difficulties till later on in school years, because they may be able to cope up in the initial periods even if they have some attention issues. So it may be diagnosed a little late. So when it comes to how we manage this, hyperactivity often comes down with age in at least 1/3 of the children, but impulsivity and inattention tends to persist even if it improves. So it may also result in some other issues that the child may develop, like being oppositional defiant disorder, like the child becomes oppositional aggressive, or may increase the risk of substance abuse or depression or anxiety. They may not be able to perform to their capacities, so their self-esteem may go down if it is not treated. So when we come to treatment, there are 2 types of treatment. One is medication and the other is therapy. So in moderate to severe cases, medication is used along with therapy, and they are quite safe. They can have some side effects, but usually they are manageable, and we have good quality studies for these medications, and they've been here for a while. There are stimulants and non-stimulants, which are the categories that are used for treating these children. And when it comes to therapy, behavior modification is not some kind of a magic bullet that works instantaneously. In this, the parents and the caregivers are trained in strategies or techniques to handle the child's behavior, for improving their attention and focus, and for reducing the hyperactivity. It will take time to work, and you can see improvements over periods of time with regular practice over months and years. But the more important part is that we need to focus on the child's positives and ensure that we take care of their self-esteem. If the child's self-esteem is preserved, then the child will do well in future also. And that is the most important thing here. Thank you.